Thank you again for joining us today. My name is Andrew Yang. I am the manager here at Unite LA for post-secondary systems and policy, supporting the LA Region K-16 Collaborative. Today's session is all about sharing what we're seeing in LA's healthcare pathways, where opportunity is growing, where gaps persist, and where collaboration will really matter if we want to connect students to family-sustaining careers. Um, Here's our roadmap for the hour. I'll start with a quick rounding in the K-16 Collaborative and why this report matters to us. We'll then hand it off to our partners at WestEd to walk through some of the key findings from the Healthcare Labor Market and Pathways report. And after that, we'll move into a conversation with our panelists, followed by some time for your questions, and we'll close with some next steps and ways to stay engaged. As a quick reminder of our regional goal, at its core, our LA Region K-16 Collaborative exists to close racial and gender gaps in post-secondary attainment and employment. We're focused on building equitable pathways in several industries, including healthcare, engineering, and computer science. And we're doing this together across 5 CSUs, 2 UCs, 12 community colleges, 8 school districts, many workforce and civic partners. What really makes our region unique and complex is our scale. The work is happening across 5 subregions, each with different institutions, employers, and local realities. And these subregional partnerships are where strategy really turns into action, where we're seeing dual enrollment, transfer, and work-based learning actually get built. With that context, I want to turn us to the report itself. I want to share, I want to turn this over to our partners over at WestEd to share some of our key findings from this Health Pathways report. And let me pass it over to Rachel and Alex.
Wonderful. Thank you, Andrew. And hello, everyone. My name is Alex Lozanoff, and I'm a senior project manager at WestEd, and I've had the pleasure of working with the K-16 Collaborative and a number of you over the past few years. And in support of that work, the Unite LA commissioned us to write a report to help answer a few key research questions, which we've outlined on a slide here. That really allowed us to analyze labor market information from California public sources, as well as data from Lightcast and the Bureau of Labor Statistics, to provide some insights around where the healthcare occupations were headed towards the future. So we can go next slide, please. Wonderful. So the 3 key research questions that guided this report and that we'll share highlights from today are, where are the in-demand and high-growth jobs in healthcare in LA County? Who holds those in-demand healthcare jobs? And how are students currently being prepared or not prepared for them? So I will share some key highlights from the first 2 research questions, and then we'll turn things over to Rachel, my colleague, to share from the third. And I will also note that we want to leave plenty of time so you can hear about all of this in practice and hear from the panelists. So we'll just share some key highlights and really recommend that you spend some time diving into the details of the report, which if you haven't seen yet, we'll link at the end of the presentation. So, but let's share a few of these key highlights. Okay. So first and foremost, surprising, probably no one in this room, the health sector is growing with significant employment opportunities in the region. So between 2022 and 2026, so really up until this year, these industries are projected to add over 42,000 new jobs. So that includes new jobs in ambulatory healthcare, hospitals, and nursing residential care facilities. And it's noted that it's the ambulatory healthcare that will drive most of this growth. Ambulatory, I knew when I signed up to do this slide that that word was going to get me every time. But ambulatory healthcare is essentially, if we think healthcare in which people walk themselves or roll themselves or crutch themselves into. So that includes healthcare related to offices of physicians, dentists, and other practitioners, outpatient care facilities, mental and diagnostic laboratories, and other, which do include home health care services, ambulance services, and blood banks. So if you want to think about that, we're not talking about hospitals, but we're talking about sort of that very large sector of how most of us may interact with the healthcare system on a semi-regular, hopefully not too regular basis. Okay, so if we want to get and dive deeply into what are these high growth occupations, and we're going to focus specifically on the ambulatory healthcare focus. So if we can go into that, let's see. What you're seeing here is a grouping of high growth healthcare occupations by the typical level of education for entry. And so it's really important to notice that the growth is not concentrated at just one level. We see growth at all levels of education. On the left, you see occupations that require a post-secondary non-degree award. So that includes roles like licensed practical or vocational nurses and dental assistants. These are often shorter-term pathways, and they play a critical role in the healthcare system and are frequently entry points for adult learners. In the middle column are occupations that require an associate's degree. So we can think dental hygienists, physical therapist assistants, and radiological technologists and technicians. So these are especially important for this conversation because they tend to offer strong wages, they have high demand and clear advancement potential, and they are still accessible through community college pathways. And then on the right are roles that typically require a bachelor's degree or higher. So that includes registered nurses, behavioral health counselors, and healthcare managers. These roles are essential, but also have longer, more expensive pathways, and they rely heavily on what happens earlier in the pipeline. So the key takeaway of this slide is that one level is not that one level is better than the other. It's that the healthcare workforce depends on all three, and that breakdowns and across these three levels really have implications for how we design pathways. So from a systems perspective, this slide also lets us really explain why community college sits at the center of the healthcare workforce development. And community colleges are uniquely positioned to support both the non-degree and associate's degree roles that see strong growth, and that can also serve as on-ramps into those bachelor's degree pathways over time. So we'll talk a little bit more about that when we talk about the findings related to the pathways. We want to be thinking about how and are our education systems investing proportionately into the levels of education where growth, access, and mobility intersect most strongly. Okay. Now, this is particularly important because while healthcare employment is growing rapidly, high employment demand doesn't always equate to high wages. And so not all of these jobs are going to lead to economic security. And in fact, we see that median earnings for 9 of the top 20 healthcare occupations in LA County earn less than $50,000. So that means that folks who work in 9 out of the 20 top healthcare occupations are not earning enough to meet a self-sufficiency standard, which means that they can afford the basic expenses of a single adult. We can see that as a very good example in one of the fastest growing roles in the sector, which is home and personal care aides. These folks have median wages of just over $32,000, which is far below what it takes to afford basic expenses in the LA area. So as educators and as system leaders, this forces us to really tackle a critical question. Are we preparing students for jobs that are growing or for jobs that actually support long-term stability? And of course, we want both with that real emphasis on stability. Because growth enough isn't alone. Wage and advancement potential matter just as much. And that is particularly important given that we see equity gaps in the workforce demographics across the county. So we see that compared to the overall population, Hispanic and Latino residents are underrepresented in the top 20 occupations in the country's healthcare and in the county's healthcare, while white, Black, and Asian workers are overrepresented. Now, given what we just covered, oh, and I'm sorry, if we can go to the next slide, please. There we are. Thank you. That illustrates that those inequity gaps and underrepresentation that I was just mentioning. So it's important to note, given that what you were just looking at in terms of the range of salaries, that we want to be looking at the occupations themselves. And when we do, we see some really notable inequities. So we see that women of color and immigrant workers are disproportionately concentrated in the lowest paid, highest risk healthcare jobs. So we can see, for example, that Hispanic and Latino residents are 48% of the county's population, but 62% of medical assistants, where the median annual income is $39,000. So again, below that self-sufficiency standard. Meanwhile, only 22% of nurse practitioners who have a median income of $153K, dramatically different than that of medical assistants. Only 22% of nurse practitioners identify as Hispanic or Latino. So we see that really notable difference for the roles that folks occupy and what they're earning. Next slide, please. And if we look across occupations, we see that these inequities are pervasive across those 20 occupations that are the top growing in the region. And in fact, as the diversity of a job increases, median wages tend to decrease. That means, and this is really notable, that the most heavily staffed by women, the occupations that are most heavily staffed by women of color and immigrant workers are often the lowest paid roles in the sector. This really underscores systemic barriers to advancement and highlights the need for more inclusive pathways. It's not about individual choice, as we all know. It really reflects how pathways are structured and which roles have clear advancement ladders and where those barriers exist. So with that really call to action, I will turn the presentation to my colleague, Rachel Antrobus, to share the needs and the opportunities to strengthen pathways to those well-paying healthcare jobs.
Thank you, Alex. Hi, all. I'm Rachel Antrobus. I am the Director of Intersegmental Projects at the Center for Economic Mobility at WestEd. I am very happy to see you all. I see some very familiar names and faces. Many of you were able to support and give some insights into this study. So I appreciate that work that you've done so far. So, and I really appreciate all the practitioners that are able to be here and the work that you're doing every day for students. So this section is really focused on the kind of sweet spot that Alex was referring to earlier, which is the space between kind of those entry-level jobs and those jobs requiring a bachelor's degree. We focused on those jobs that pay those family-sustaining wages that Alex was mentioning, and that are also accessible through community college. And what we're going to share with you all is that despite the demand, there is not enough completion happening to meet that demand. And we want to just emphasize throughout the next few slides that this gap is not because students aren't interested. It's because of the program's constraints, which includes capacity, barriers to completion, and misalignment. So we want to talk about this piece in particular because we, after this analysis, found that bridging the gap here between in these middle skills spaces and occupations is one of the most effective ways that education at large, but public education in particular, can directly support the workforce needs and economic mobility in the county. So thank you. Next slide, please. Thank you. Okay, so the data that we analyzed revealed this troubling paradox that you see here. While community colleges are positioned as a primary workforce development engine for middle skill healthcare careers, they currently produce just a fraction of what's needed. This misalignment forces students, particularly those from underserved communities, towards expensive private programs that often saddle graduates with substantial debt, while failing to address the regional workforce shortages. We're going to talk a little bit about that effect of the debt in just a moment. Next slide, thank you. Okay, so here we're looking for the share of for-profit colleges that enroll the healthcare students. But we know this is at a really high cost and risk. The students at these private institutions default at 4 times the rate of community college students in their loans, and the received 24,000 federal complaints just between 2017 and 2019 over misleading employment claims. So we know they're promised a lot, but not always delivering. And this combination of high occupational demand and this dominance for for-profit training highlights this urgency and opportunity to expand and strengthen community college pathways, and that we know there's demand here. Thank you. Next slide. Thank you. Excuse me. So what you're seeing here is the average annual net cost for students who receive federal financial aid. The net cost, as many of you already know, includes tuition fees and living expenses, minus the grants and scholarships that a student receives. So this is a closer approximation of what students are actually paying out of pocket or financing with loans or other sources. On the top half of the chart, on top of that blue line is the community colleges in the LA region. Their net costs are relatively low, even for students with significant financial need. On the bottom, you see private institutions, including for-profit colleges. This difference is obviously pretty striking, in some cases 2 to 3 times higher per year. This matters because public programs often lack capacity or have low completion rates, so students don't stop pursuing healthcare careers. Instead, many of them turn to these higher cost options, and they accumulate a substantial debt to access those trainings for the same occupations. In the short term, obviously, that debt affects students' ability to persist through the programs, and increasing their stress and work hours, and the likelihood that they'll stop out. But in the long term, it shapes their economic mobility overall, in that much of their income is going to go to loan repayment, whether they can build savings and buy a home or pursue further education or have a family. So affordability isn't just about this access, it's about the quality of the outcomes that follow. So to Alex's point, really building this pipeline is where we were focused, and what surfaced. Next, thank you. So here we're looking at the expansion of community college enrollment within these healthcare programs. Would not only increase the number of prospective workers, community colleges are also really well positioned to address what Alex had brought up earlier, which is increasing diversity in the field. We see here that healthcare program completers at the community colleges largely reflect the county's diversity. With equitable access to and expanded programs, there would be more graduates of color prepared to enter those well-paying jobs. Thank you. Okay. So across healthcare programs, community colleges are enrolling diverse students, as we know, but completion rates remain extremely low. Generally, we saw between 7 and 11%. And that's true across programs and student groups. It represents a major missed opportunity for equity and for workforce supply. And what we wrote about in the report was even those very modest gains would really have a transformative effect in the region. For instance, in radiology, raising completion rates to 20% would double the number of graduates that they're able to produce. In an LVM program, increasing the completion just 3 to 4% to closer to 15% could quadruple or even quintuple graduates in that program. Improving completion isn't just about student success, it's the fastest and most cost-effective way to close those healthcare shortages and make training more affordable and equitable. Thank you. These 5 middle skill occupations were those that represented the strongest opportunity for public investment and capacity improvement, because they combine those high demand, family sustaining wages, manageable training timelines, and clear advancement potential. And also, most importantly, the community colleges are already positioned to play a central role, making them a strong candidate for that kind of investment and focus that we need. So you'll see in the report, there's some pretty deep dives on these 5 occupations, including a breakdown in who's in those jobs, what the unmet need is, and also some of that more detailed barriers and constraints that those programs face. Thanks, Andrew. Excuse me. Lastly, before I hand it back over to Adam and Unite LA, we just wanted to touch on those barriers, just high level. You're going to see in the report, if you dig into that section, that these barriers are fairly consistent across programs, and will not be new to most of you on the call. Admission bottlenecks, limited clinical placements, and the kind of strain that shows up for students are kind of across the board in all of the programs we analyzed. These are capacity and design challenges, and we want to emphasize they're not student deficits. We have some really wonderful students in LA County that want to be in these jobs, but the programs are not always able to meet their needs. So just want to emphasize that if it's not obvious, that these constraints have to be addressed in order to actually close this gap, because increasing enrollment will not do what's needed to improve these programs. So I will hand it back over to Adam, who's going to share a little bit more about what the K-16 and cross-sector partners can do to make some sense of this and take some action.
Thank you, Rachel. And I'll say this report closes out with a number of set of recommendations for individuals and systems across the LA region, as we have a great panel that you'll hear momentarily representing workforce and higher education. We're just going to stick with our K-16 partners and our cross-sector partners in this section, but please do check out the report for a more comprehensive list of recommendations. So as you'll see here, a number of recommendations for K-16 partners to take immediate action. First and foremost, prioritize investment in 5 middle school occupations that you just heard about. Of course, these are the most in-demand sectors or most in-demand positions that we're hearing about now. The thing that we understand about them is that the demand for these positions, demand for these skills, are far outpacing the supply of students that we have for them. We have to think about what can we do to engage not just our education systems, but our workforce systems in closing those barriers, thinking about clinical placements, faculty, coordination, simulation capacity, and so on. Really thinking about how we can support students in working toward these skills, earning those degrees, and entering the workforce. In thinking about helping those students, we have to implement comprehensive wraparound services. Obviously, this is something that I think every sector is looking at right now in many different ways, whether it be housing, whether it be childcare, transportation, and other supports. We as a region need to go further to ensure that our citizens have opportunities to take advantage of wraparound services, to be able to go through their education, through these programs, to meet the demands that the region is seeing. The third is just develop stackable credential pathways. This is, of course, something that the K-16 Collaborative, ours, and those across the state are really focusing on, ensuring that the student's education doesn't necessarily begin or end with one institution or in one pathway, but ensuring that there's access to different academic programs, to different opportunities for students to take advantage of navigating clinical schedules, navigating clinical schedules or other requirements that stackable credentials would enable them to earn more in terms of credentials, earn more funding for this work. Strengthening articulation agreement goes hand in hand with that. Of course, as K-16 partners, we're really ensuring that the agreements, the processes between our community colleges, our CSUs, our K-12 community college CSUs, UCs, work for students and work for what the region needs in terms of opportunities to align in ensuring that students have access to prerequisites, access to upper division courses, and access to the healthcare credits that not just the one needs to graduate with a degree or certificate, but really what employers need in terms of skills. Collaborating on shared clinical placement systems. Truly, we see this throughout the report, and of course, many of you probably see it throughout your lives. We need to point to regional collaboration where institutions coordinate rather than compete. In this sense, we must ensure that we're working with one another to find placements for students, not just with employers, but working with our education institutions to make sure there's space, make sure there's coordination and timing and opportunity for all students to earn those hours that they might need to complete their credentials, which are incredibly important for earning that degree. Partnering with major healthcare employers, and of course, we're very excited to have representative of major healthcare employers on the call today. But really think about how we can work with our employers to design programs to ensure that there are work-based learning opportunities or other kind of experiential education opportunities that address the need for students to have access to careers, have access to these organizations, to look toward guaranteed job placements or earn and learn opportunities to make sure that the students are prepared, are able to access the numerous pathways and numerous positions that are available for them in the LA region. And finally, engage labor unions. This is incredibly important, especially today, as if anyone's seen a Kaiser today, you'll notice about 30,000 striking healthcare workers in front of about 2 or 3 dozen hospitals. Working with labor unions to develop training partnerships that combine occupational skills with worker-friendly practices, advancement opportunities, and again, wraparound services on the employer side are incredibly important to make sure that our healthcare workforce is, one, maintained, and two, has opportunities to grow, which you'll of course see in the report is another problem that we see in terms of where these individuals might go in moving up in organizations as opposed to moving out of organizations. And we're to the last slide, which focuses on cross-sector partnerships. What can they do for immediate actions? Again, this focuses on not just K-16, but broadly across the region. Develop public-private partnerships that combine community college affordability with private sector efficiency and program delivery. We're thinking about the biggest constraints in healthcare, how they sit between systems and not within them. So what can we do as numerous systems to work together to change how we look at that transition period for students and for workers? Create regional healthcare workforce data sharing systems. Of course, this is a huge solution in just about everything we see. How do we use data to make data and how to make informed decisions? How do we share data with one another to develop better capacity alignment and bring workforce opportunities to scale? And finally, establish outcomes-based funding models. We see this in a number of places in education. What can we do to better inspire and motivate education partners, workforce partners, civic partners, frankly, to make most efficient use of our limited resources and make most efficient use of our limited availability in clinical sites or classrooms, but to create possibly outcome-based funding models, those that will ensure that we are able to hold our partners accountable while also making sure that our students and our workforce is prepared for positions that we need them to hold. So with that, that is just a tease of the report, and we're very excited that at the end of this webinar, we will share the report with you. Before I do go on to our conversation with our panelists, I do want to thank, of course, Rachel from Wested, her colleague, Ali Balela, United LA's very own Carrie Lamont, for the three of them worked incredibly hard on this report. It's our primary authors. I'll also thank our partners at LAEDC for providing initial data and context for the report. So without them, this would be all of them wouldn't be able to do this, but we're very excited that this is out here in the world for you all to use and access. And we're very excited that at the end of this conversation, we'll have an opportunity for questions, and we'll bring, I think, Alex and Rachel back on to answer any of those technical questions. I know there's already been one or two in the chat, and thank you for responding to those. Any others, please feel free to keep going in the chat. We'll monitor that, or feel free to raise your hand toward the end. With that, I will invite our speakers, Teri Hollingsworth and Dr. Amber Johnson, to join me on screen. I know we're all on screen together. By that, I mean, let me star them so you can see them. If I can find the star, gosh. Spotlight for everyone. There we go. So we're going to make sure that everyone can see Amber and Teri. Really, my first question for you all, everyone can see your titles here on screen, but I'd love for you to really introduce yourselves, not just your titles, what you do at your respective organizations. And I'll say from, yes, Andrew, if you can stop sharing, actually, that'll help us highlight folks. Thank you. I'll ask Terry and Amber to introduce themselves. I think I have the spotlights and everyone. There we go. And give us a sense of what you do in your organizations. Terry, we'll start with you.
Okay, well, thank you so much, Adam, and thank you for the invitation to really speak on this important work. So I'm Teri Hollingsworth, Vice President of HR and Education Services with the Hospital Association of Southern California. We are a regional trade association representing over 170 hospitals across the Southern California region. And our role in the workforce space is that we serve as an intermediary and a convener around this work. Our goal is to ensure alignment between our member hospitals and our stakeholders in the community, including academic institutions, training providers, and other stakeholders. So I'm happy to be here, and thank you for having me.
I'll follow behind you. My name is Amber Johnson. I am an associate professor in the Department of Health Science at Cal State Long Beach. I am also the I'm also the director of the Center for Health Equity Research, or SHARE, here at the university. And I also represent the College of Health and Human Services in collaboration, or the K-16 collaboration with the College of Engineering as well. That's at Cal State University Long Beach. Also in collaboration with LBCC, Long Beach Community College, and LB Unified School District as well. So I lead the College of Health and Human Services efforts in regards to thinking about pathways, engagement, recruitment, retention, as well as workforce placement on behalf of the College of Health and Human Services. Thank you so much for the invitation. I'm excited to be here.
Well, we thank you both. I'll say Amber recently has become our appointed by us K-16 spokesperson, who is always so generous and able to promote the collaboration between not just her campus, but also with the K-12 and community college system. I'll also note on the K-16 side, Terry is one of our founding stewardship group members for the K-16 Collaborative, really supporting our regional direction across numerous education and workforce institutions. So with that, we'll get your just initial reflections on the report. Would love for you all to share what stood out most to you in this report, especially in terms of where you see pathways maybe breaking down, or where you in your capacity see them being misaligned in the Los Angeles region, and maybe do any of these findings resonate with you in your day-to-day life, or what you're seeing for students or employees across the region. We'll start with you, Terry. You're off mute.
Oh, okay, great. All right. Well, thank you. I think what stood out to me the most was how fragmented the pathway is between education and employment, especially at transition points. We see interest in healthcare careers, but leakage occurs between high school, community college, and clinical placement. And in Los Angeles, the demand is high, but capacity and alignment are not, particularly for programs requiring clinical hours and licensure or limited faculty. So students are completing education or training programs that are related to healthcare jobs, but those programs don't always line up directly with the specific roles, credentials, or competencies that employers are actively hiring for. So we hear this from our work that we do out in the community, but the report really highlighted this particular point.
Yeah, I think I will add maybe 3 points. Something that I'm not surprised, but always stands out to me that I always want to amplify are the disparities in these healthcare occupations as well, particularly representation within our Hispanic Latino population, and across the board, right? So really underlying and amplifying the need to address those systemic barriers is something that I think the the report actually provided recommendations that I found very influential, and something that I think that I would take back and think about how can we take these recommendations and then implement them from the university side. I also found that there were the progression from, well, I don't want to say the lower wage role, but the entry level roles to more higher wage roles, and the breakdown in that progression. And it made me think about, well, what's going on there. And I have some thoughts about that later on. But and I think my last point would be sort of the what is considered, the top 20 healthcare occupations. And I was excited and surprised to see that things like billing and administrative staff, and which I think what should be encompassed more, behavioral health occupations as far as healthcare, are things that we consider. They're all important to the healthcare system. And so I'm happy to see that represented, and I'm interested to see how we can even build off of that as well.
Thank you both. And Amber, I'll get the mic back to you to pick up on I'll pick up what you're putting down. We're seeing in the report persistent wage and racial inequities across all the occupations listed, those 20, and then those that we don't even have in as call outs in the report. In thinking about how we're looking at these inequities in wage, in race, in maybe even locales, in your experience, can you talk a bit about where you're seeing students get stuck, maybe why they're getting stuck, and I'll even go a level deeper for you, knowing your work in early exposure, knowing your work in advising. What are those maybe interventions on the education side that you see as uh, uh, make promising practices to end some of these barriers or at least work around them?
Yes, thank you for that question. I think particularly in the context of California, people have to work to live. You literally have to work to be able to live and survive. And school can be expensive. Even with financial aid, you still have to work, right? You have to even to complete the necessary training, you have to take off time to work. So I think about people who have to work, who have to pay the bills, who have to worry about gas, worry about food, worry about potentially taking care of a relative, whether it be a child or an ailing parent or another family member. They have to commute to school many times for these training. You have to pay for parking. Then after having to deal with all of that, you have to find a quiet time to focus and to study while you have all of those things going on in the background. And so I think they're getting stuck with life beyond their control. And I know, and I think that the report alludes to that, and it may seem extreme, but given the level of healthcare needs within our country and the amount of profit within the healthcare industry, we really should be paying people to train in the healthcare fields, right? Particularly in California, where I was looking that it costs approximately $112,000 to live comfortably. So I think people are getting stuck not only with thinking about academically, because I think we're within the system of within the Long Beach region, in which I'm talking about contextually, we're doing a better job of understanding the supports and the needs and the wraparound services around students, even though we have much farther to go. So when we think about what else is left to be done, one of the things that we're starting to do, number one, is start earlier in middle school, right? It's important for not only are these occupations accessible, but people are aware of these occupations. When we talk to middle school students, we see that middle school students know about being a teacher, a lawyer, a nurse, doctor, maybe a social worker, but that's it. And so when you go to high school or you're preparing to go to high school in Long Beach Unified School District, by the time you're in eighth grade, you have to pick a pathway. So if we are engage the students in high school, we are waiting too late, right? In addition, we recently did our first iteration of the Sankofa Academy at the Beach, where we brought Black middle school students to our campus to engage with people in the healthcare fields and the College of Health and Human Services, as well as the College of Engineering, so that number one, they can see what that's like. They didn't know about all the different opportunities that can be afforded within the healthcare space. So we began to raise awareness. We began to raise identity development. I can see myself. We also engage the parents. The parents sometimes don't know about these opportunities and how to facilitate that. So bringing in both the students and the parents and engaging them are one way to not only raise awareness, but begin to prepare earlier than high school. So I'm hoping I'm answering that question effectively, but I'll be happy to add more context if needed.
You are answering effectively, and I appreciate that. And I'm also going to drop a link for everyone, a brand new story about Amber's work with Sankofa Summer Academy at Long Beach that we just put on the website this week, and hope everyone takes a look at to learn a bit more about the programs that K-16 Collaborative is supporting at the beach. And I will pose the same question to you, Teri, and think specifically about those barriers that employers are seeing when they're trying to hire or advance talent from entry-level roles into more specialized credential positions or administrative positions.
Yeah. I mean, I think Amber really pointed out some excellent points. But what we're hearing from our member hospitals in terms of where students and workers are most likely to get stuck and why. There are three key areas. One would be after entry-level roles, such as, as an example, a patient care assistant or environmental services. Unless there are clear pathways on how to get beyond those entry-level positions, the incumbent will get stuck there. And so I think that there's an opportunity for employers across the board to really do a better job at sitting down and creating career pathways for advancement. Another key area would be between the coursework and clinical placements, where competition and capacity constraints slow progress. So we know that there are issues with the clinical placements of students coming through healthcare programs and the lack of capacity on the healthcare side. I think we really need to focus in on that issue. These clinical placement systems that are out there are to help coordinate and manage the process. However, the problem that we're seeing across the state is that there's not just one system, there are many systems, and they don't all speak together. There's not just one repository. So it's almost like the Wild West out there in terms of really understanding what the need is. We're not able to quantify the shortage, but we know that there's a shortage. So there's an opportunity for us to really make a difference there by really focusing on finding a solution to the clinical placement coordination. And then there's another area at licensure and certification. Sometimes it can create financial barriers for students coming through the pipeline. They can't afford to pay certain license fees or certification fees. For some students, they might need other supports, language supports out there, or other wraparound services to help them be successful in these programs. So those are some of the areas that we see that I hear from our member hospitals where students and workers typically get stuck.
Thank you for that perspective, and for making us think about what we need to be thinking of now, what we can be doing together to support not just your member hospitals, but the employees of those hospitals. We have about 10 minutes left within our time together. I have about 30 more questions that we intended to ask you, but of course that's never going to happen. So I'm going to do is head toward maybe the wrap-up question for you all before I invite Rachel back and invite anyone in the audience to ask any questions of you all about what you're seeing, how you're reacting to the report, how you're working through the your jobs in this field, which is offering so many curveballs to you in any given day. Um, but as you both mentioned, not just the recommendations you've seen in the report and some of the processes and opportunities, I want you to maybe hone in a little bit and think about looking ahead 5, 10, 15 years in the future. Where do you see the greatest momentum in strengthening LA's healthcare pipeline? As a first question. And two, how do you think that the K16 collaborative, our mission to really support one another and support our systems and strengthen our systems in supporting our students, where do you see that helping accelerate the work that you see as opportune in strengthening our healthcare pipeline? Teri, we can start with you.
Okay, great. I think to start, I think the greatest opportunity for momentum is in formalizing a small number of middle skill pathways that are directly tied to real higher demand. These roles where we know where the jobs exist and the wages support economic mobility. And the bottlenecks are largely systemic rather than individual. I think we can, if we were to focus our attention in that area, I think that the K16 Collaborative is uniquely positioned to help accelerate this work by convening employers, and the association is here to help, as well as educators around specific occupations. And by doing so, we can, sort of help support the sharing of labor market data, which is key to this work, and, help break funding across the education and workforce system so that efforts are aligned rather than siloed. So I think that in this way, the K16 Collaborative can serve as a connector and an accelerator, creating the conditions for scale and sustainability. So those are my thoughts there.
I would totally agree with that, Terry. I think I would add, the K16 Collaborative should continue to be a convener of partnerships that facilitates communication. I think when there is leakage in the pipeline, a lot of that has to do with lack of communication between the key stakeholders that contribute to the pathway of success for individuals that are looking forward to obtaining a career in healthcare. So I think that continuing to strengthen the pipeline, plugging plugging leaks in the pipeline, and many of that can be done through genuine relationships, through partnerships, open communication, sharing of data, sharing of challenges, all of those things that will help strengthen the pipeline, and the K16 Collaborative can be a convener in strengthening of that pipeline. Of course, with funding, and continue advocacy work around funding as well.
Well, we appreciate that plug for funding. If there's anyone who has a direct line to the state government, please let them know. And of course, we appreciate both your perspectives on what we can do to advance the work, not just as individual institutions, but together. So I'm going to invite Rachel back to the screen. I've just spotlighted you. And for anyone that has questions for Amber or Terry as expert panelists, for Rachel as an author of this report, we invite you to raise your hand, come off of mute to ask it, drop it in the chat. I do see one in the chat already from Carrie, who is a co-author of this paper, so I'm going to ignore that one for now and invite anyone else who doesn't have Terry or Amber on speed dial. I invite you all not to give Carrie the satisfaction of having me ask her a question. Okay, fine. We'll start with an easy one. Carrie, you want to come off mute and ask your question?
Yes, thank you, Adam. It is a good question, so I'm glad we can get to it. Terry, I think this is mostly in response to your remarks about, employers not really investing in that like upskilling for their own employees so that they don't know the pathway, or they're not supporting their workers from these entry level positions into higher wage roles. And so I'm wondering, like, what do you see? Have you heard from employers, and like what's the breakdown there? Like, what's the challenge? What's preventing them from doing the work themselves of helping their employees understand the pathway and access a pathway to higher wage roles within their own, hospital system?
I think my response will not be surprising, but it always sometimes comes down to time and resources available to really sit there and do the work. As hospitals and other healthcare providers are struggling with trying to fill the current vacancies of the day, really setting aside the time to build out those pathways and to communicate them to your staff to ensure that they understand what the next step is in terms of the progression. It takes time. It takes time, and many of our hospitals don't have the resources as some of the larger organizations like a Cedars or a Kaiser. They have to really be strategic in terms of where they focus their resources. So I think that's what it comes down to. But I think that there's an opportunity for us to help collectively because I think that if we can develop those pathways, they could be used as templates for them to build upon so that they're not starting from ground one. And so I think we can help lift that burden for many of our employers.
Teri. Um, Again, for the audience, like I said, I have a dozen other questions I can ask, and if you're interested in me, asking those, I will. But anyone else in the room, I know we have folks from all walks of life here, from industry, from K-12, higher education, otherwise. Love to hear any thoughts you have either on the report, questions you might have for the speakers in our final moments here. Misuk, I saw you got me.
Good to see you, so many of you. I have to second what Terry just said. We try to develop that pathway with Common Spirit Health, where they have like 30 some hospitals across California. And exactly, Terry, what you said, they're struggling with the resources of people who can manage that pathway. And university is the same. If we have a cohort of group from a hospital to do upscaling with us, we need to provide them wrap around the services, like Adam, as you said, for their completion rate. We need resources too here. And so we actually applied a HRSA grant to be able to do that. And then HRSA grant is gone. So that's exactly the same reason that we are unable to do it. But what I learned in the process with our faculty group, employers have benefits, that the tuition support benefit right there. And it's just a matter of identifying resources to coordinate that in one employer side and one in the university side so that we can provide the support that they need. That's what I think will solve many of these problems. I want to share that my perspective.
Thank you, Misa. It's good to see you.
All right, we have a minute left, just a moment. I will either let everyone get off early or give one last person a chance for a final piece. Either way, I'm going to put in the chat now the report. If you've not read it already, we hope you do. If you have questions, comments about it, just want to sit down and chat, we're all available from the K16 Collaborative or our partners to talk to you about it. Again, very, very special thanks to Teri and Amber for being here, to Rachel and Alex for presenting on the data and the great work that the report is going to lead us to. We hope you read that. We hope you read the article about Sankofa Academy at the beach and the great work that Amber's doing on the ground with our students. With that, it is 1 p.m. You all have meetings to get to. thank you for joining us, and we will see you next time.